Dr. John, can you hear me? Well, welcome. This is Wendy Briggs. I'm trying to get everything all set here with the audio, and then we'll go ahead and begin our webinar this evening. Dr. John, are you? Okay.
Can you hear me now, Wendy?
There we go.
All right, very good.
Great. Well, I'm glad they can hear you.
That's the webinar gods are smiling upon us tonight. That's good. You
Don't be
just
too
never know.
hasty. Yes,
That's
knock
true.
on
Yeah,
some wood.
I was knocking on wood while I said that, so
Okay, very
we're
good.
good.
Well, welcome everyone. We're so glad you could join us tonight for our special presentation of Megatrends in Dentistry. We are doing a webinar series. This is the first of a four-part webinar series here over the next few weeks, where we will be highlighting some revolutionary strategies with those of you who attend. So with that said, I would like to introduce you to Dr. John Meis. He is a very successful practicing dentist, but he is also a partner in 89 dental practices across the country and an incredible mind in dentistry. So he also happens to be my partner in the Team Training Institute, and it's an absolute pleasure to work with him.
Well, Wendy, I feel the same way about you. Thanks for that nice introduction. And Wendy being a star, she doesn't really need any introduction, but Wendy has had many, many years in dentistry as a practicing hygienist and then as a hygiene coach, and now a practice coach and mentor and leader. And she is an amazing speaker and an amazing problem solver. And it's just a real pleasure to have the opportunity to work with her because she is absolutely amazing.
Well, great. Thanks, Dr. John. Well, let's get right to it, shall we? Let's go ahead and start talking about some of the mega trends that we see in dentistry. Now, we usually teach 10 mega trends, and we aren't going to have time to teach all 10 of those here tonight, but we want to highlight on a few that we think are really insightful and important for those who are currently practicing dentistry and trying to improve their practices to know.
Just a little background, this Megatrends presentation that you're seeing a portion of tonight was really was asked the executive team at the world's largest dental company asked us to put together some thoughts on what we saw as the megatrends in dentistry, and so this is our presentation to them as they are thinking about how they're going to position their billion-dollar company. Um, they were interested to hear ideas. So one of the first megatrends is the emergence of what I'm going to call the dental CEO. And the dental CEO, you know one when you see one. So they're the kind of person that has a very good handle on the clinical side of dentistry, but they also have a very good handle on the business side of dentistry. And these dental CEOs aren't necessarily in, you know, 30 location type dental practices. They can be in a single practice. And they just have a very clear understanding of the numbers that drive dental practices, of the disciplines that drive dental practices, and they have a very clear understanding used to get there.
Yeah, I would say
Um,
too, Dr. John, if I might just interject, it seems that we are also seeing a tremendous shift. As you see in the picture here, it used to be that there'd be one dentist with a few team members, and that was all that the practice ever really came to be. And it seems now that this isn't true for everyone, but we are seeing a tremendous shift into larger teams and
yeah.
multiple doctors and multiple providers at each location, which I think in some ways makes the necessity for a dental CEO even more critical.
As the practice gets larger, the more employees you have, the more sophisticated the leader has to be. And we are definitely seeing a growth in the size of practices. These people who have, cracked the code, so to say, on practice growth, they very quickly run out of one dentist's hands. I mean, there's only so much a single dentist can do, and once that dentist is hitting at that high level, now they're on to dentist number two, and maybe they're on to a bigger location. Maybe they're on to location 2 or 3 or 4. But we're definitely seeing the ones who crack this, their practices are growing, their profitability is going up by factors of 2, 3, 4, 10. You name it, and we're seeing it happen.
That's exactly right. So that's I think all the more reason that we are seeing more and more dental CEOs emerge. And so I don't know if you want to walk through kind of some of the things that we often see with the dental CEOs that are doing a phenomenal job.
Yeah, I think one of the basic fundamental thoughts that the dental CEO has is that they think of the practice as a business, and the product is a great patient experience. And uh, People that aren't really dental CEOs just don't think of it in that same way. So the dental CEO thinks about how we can give the patients a better experience, better quality of care, a better experience while they're in the office. All those things are going to lead to greater business success. So they understand business principles in that they're making their product better, and as they make their product better, the business will do better.
I think too that one of the things that I often see when it comes to great patient experience is I see a lot of dental CEOs really getting the team involved in that, not just the hygiene team, but giving a lot of the team an opportunity to help create a more efficient system and a more world-class level experience, if you will. And that I think helps drive the success that continues going forward, which can also, once they really have that great patient experience figured out, it can lead to issues with capacity.
No doubt. If the dentist's job in the practice is being a leader very part-time and being a provider most of the time, um, that is the most profitable scenario. But eventually, that dentist is going to run out if they have a great patient experience. Let me say this. This is a bold statement, and it's maybe a departure from what I had thought years ago. But the more and more I see what's happening in the market today, practices that have a great patient experience are not worried about marketing because they're attracting so many patients. And as they attract patients, ultimately what happens is we run out of capacity. We don't have enough something to treat all the patients who want to be treated. We don't have enough doctor time. We don't have enough hygiene time. We don't have enough assistants. We don't have enough chairs. We don't have whatever it is. We start running out of capacity. And dental CEOs know that capacity um, shortfalls are very, very, very difficult to spot. And they might be expensive in the short term to fix. They get really good at spotting those things.
And I think more than just spotting it, Dr. John, they're actually able and willing to do something about it. You
That's a good
know,
point.
yeah. All the people that recognize they're out of capacity, but they still continue marketing it. I just can't quite comprehend that. If you don't have high demand appointment times to offer your patients, you're marketing for the guy down the street. So I think the dental CEO really gets that at a higher level maybe than the masses.
Yep. And the dental CEO understands that they can't do it by themselves. They have to have a dedicated, passionate team to help them get to a level. So it's a difficult transition for dentists because most dentists were good students. They were hardworking. They got themselves into dental school. They did extra things that other people just weren't willing to do. So they were very self-motivated and self-directed and just rugged individualists. And that will get you so far once you get into practice, but it will only get you so far. And there's limitations with that mentality as far how far you can go. So dental CEOs have really surpass that, and they understand that they need to have great teams and they need to be great team builders.
They also understand the Mes Curve, and I didn't really understand this until I heard you present it a few years ago, but it really is brilliant. You know, not everybody handles their capacity issues and all that the same way. So why don't you kind of go over the Meis curve with everybody
Okay.
here so they can understand that?
So don't you hate it when people name stuff after themselves? That's ridiculous. but uh, this graph kind of shows what happens in practice over time. Is you start in practice, and as you increase your effort, your productivity increases pretty dramatically at first. But you get to a point where productivity has, really come to a high level, and it's kind of peaked, and getting additional productivity is extremely difficult. And one of my great mentors, Dr. Wayne Mortensen, he was the one who taught me this. I was playing in the flat end of that curve, and I was trying to make progress in my practice by making my practice more productive. And Dr. Wayne Mortensen was doing something different. He was playing in the steep end of the curve by opening additional practices. And over time, at one time, we weren't that far apart in our earnings and whatnot, but over time, he got way out in front of me, and he really helped me understand this at a high level.
And that's important, I think, for a lot of people to understand. And I think sometimes they think, well, gosh, you know, we're a dental practice. We can't necessarily, you know, compete with Amazon. And not that we're really trying to, but the dental CEO is paying attention to what other profitable organizations are doing and trying to duplicate what they can, because there's a lot of strategies and systems that are applicable, even though we're in the business of dentistry.
It stuns me how often I will speak to a practice owner and I will ask them some simple numbers. And there are some numbers they know really well, and there's some numbers they don't know very well. And one of the stunning things about me is they don't always understand what their profitability is. And I can tell you that dental CEOs understand profitability, they understand what drives profitability, and they understand what their growth strategy is going to be, including the money that they're going to need to grow their practice, which is their capital structure.
Yeah. And these are really important things for them to understand. And again, the practice leaders, the ones that we have studied that are doing amazing things, aren't afraid to take the risks, but they educate themselves first.
I was in Alabama a couple of weeks ago, and I was speaking for a summit of a group practice that one of my favorite dental buddies, and I just love him. And we had a great time together, but he was starting to have some anxiety because he was expanding his practice at a really good clip, and well, he should. He's got a good market, a good team, he's doing all the right things, but the profitability and capital things he didn't quite understand, and so he was taking some risks, which I think are the right risks, but because he didn't understand those things, he was having some anxiety, and so we're working with him to help him get clarity on those things so that he understands those at a higher level. And when you understand those at a higher level, you move forward. You don't have the fear and anxiety, um, and then you can focus on the things within the practice, like helping your practice get continually better and better and better.
Exactly. And that's one thing too that I think a lot of the thought leaders in our industry and those who are really excelling at a high level, they are committed to continuous improvement. And one thing that I love is when we first meet dentists, and we were at the Yankee in Boston this meeting and we were speaking there, we met some really great people. And personally, I love the people that come up and say, oh, you know, we've been clients of this consulting firm, and this we've been students of this philosophy and this philosophy. Those are my favorite people to work with because I know they've been committed to continuous improvement and they
Yep,
understand the value of having mentors and
yep.
people direct them in their growth. I love working with people like that. I know you're the same.
I am, and it's funny that it's the people that want to learn from other people's experiences and really other people's mistakes, so that they don't make them, are the ones that have such rapid growth. And right now, dentistry is a wonderful profession to be in because practices are growing at rates that we haven't seen for quite some time. The momentum is back in our industry, and practices that are uh, following a simple set of guidelines are really doing extremely well. And
Absolutely.
dental, go ahead, Wendy.
I was just going to say, and that really leads us to the next thing is that as the dental CEO becomes more effective and more knowledgeable about what their role is, it becomes a really vital time to make sure the practice is tiger proof.
Yep. And tiger proof is a concept. If you think of Las Vegas shows, and I'm going to throw out a couple, Siegfried and Roy and Blue Man Group, both shows earning hundreds of millions of dollars, have hundreds of employees, have theaters dedicated to them, lots of investment in making them go. And one night on one stage of one of those shows, a tiger got spooked somehow and injured one of the performers. And that show stopped. It ended that night. Hundreds of people out of work, millions of dollars of invested lost, hundreds of millions of dollars of income never to be had again. And so that Siegfried and Roy was not very tiger proof. Now, if that same tiger was on the set of Blue Man Group and got spooked and injured one of the performers, I know what they would do. The next night, they'd paint another guy blue, and the show would go on. And it was certainly a tragedy, and I don't mean to make light of it, but there is a lesson there, and dental CEOs understand how to make their practices continually more tiger proof.
And I see this. I see this all the time. I shouldn't say all the time. Thankfully, it's not all the time, but I've seen it a number of times where sadly something goes wrong with someone's physical performance of their family life, and they're just no longer able to produce at the same level they were prior. And if they're not tiger proof, everything that you've been building for so long um, is at risk. So the dental CEO understands that and takes steps to tiger proof the practice and have the practice no longer so dependent on you as a key producer. So the next mega trend that we're going to be talking about here is consumerism. And this is something that to me is so interesting to study because so many businesses and so many industries have this figured out. And I don't know why ours seems to be so late to the dance on this issue, but we are finally seeing some significant shifts in this category. So we want to talk about that. Consumerism, obviously, in our world is about becoming more patient friendly. And there's been some things that I've noticed, and I know you have noticed this too, Dr. John. At one time, relationship ruled all decisions that patients were making. And the relationship that they worked to build with their dentist was the most important factor in the dental decisions that they are making. And we're not seeing that to be so true anymore. We are seeing the convenience factor catching relationship.
Oh, it's a huge shift, and um, the first realization that I had was what stunned me, and here was the realization. We began to ask our patients who were in our practice who had something diagnosed, asking them right there when they're there, if possible, would you like to have that taken care of today? And if they said yes, we had a multi-doctor practice, so we said the next question would be if would you like a specific doctor or would you like the first available? Or we would say these are the doctors that are here. You usually see Dr. Meis, but he's going to be unavailable for some time. Would you like to reschedule or would you like to do it today? Now I thought, and this is terrible, but I thought really, I understand how arrogant it is now, but I didn't understand it at the time. I thought, well, my patients will only see me, or there may be a few that don't, but most of them, the vast majority really will want to see me because of my wonderfulness and whatnot. Well, the truth is that that most of them, probably 80% of them, were willing to see someone else if it was more convenient for them. And so the lesson for that is it's not that I don't have a good relationship with them. It's not that they don't feel strongly about me. It's not that if all things were equal, they wouldn't prefer me, but all things weren't equal. If I couldn't see them right then, they were willing to see someone else because of convenience. So convenience is catching relationship.
And that's really interesting. Giving patients what they want is becoming really necessary for practices to continue to grow. So we study practices that are growing rapidly, and we study practices that are seeming to struggle to grow. And I have seen a direct relationship between the level of consumerism with the level of growth. Would you agree with that, Dr. John?
Oh, there's absolutely no doubt about it. Absolutely no doubt about it.
So when we talk about
The
giving patients what they want, it's all about things that we used to not have to think about in dentistry. In dentistry, it used to be a 9 to 5 business, and sometimes it was just a few days a week that we would be available to serve patients, and that is shifting.
There's no doubt about it. We see practices. I was just in a major Midwest city yesterday, and I happened to notice that I always am paying attention to the marketing that's happening. So I look at all the billboards. As I was driving around the city, we were scoping out the market there, and as we drove around, it was amazing to me that the marketing when it came to healthcare, almost everything I saw was about convenience. It was all about convenient hours, all about for hospital systems, one number. This one number will take care of all your needs. It was about ease of location. It was all about these things that you don't typically think of as being how people have traditionally chosen healthcare providers, but they are choosing on those things now. There's been a shift in how consumers think about buying their healthcare.
There has. And I would say that the more patient friendly we become, the more we have seen that to drive direct referrals of patients, which can directly affect growth. We also have those circumstances when we review phone calls where a patient is calling a practice and they're expressing an interest in maybe some response to a niche marketing. Maybe they're responding for an implant ad or one thing or another. And how that phone call is handled is critical, as we all know, but not only that, the policies that the practice has adopted as far as are they patient friendly or not? Are we insisting on 100% cash up front, patient bill their own insurance? That was the pipe dream of the 90s, really. That's kind of going away. Now, there are some people that are able to still do that at a high level, but the reality is, many of our patients are looking for flexible payment options. They want availability for appointments during high demand times. If you offer evening hours, but you're booked out 6 weeks for those evening hours, that's not very patient friendly at this point. And it's probably limiting your growth more than you possibly realize.
Wendy and I do a lecture that really walks audiences through what patients want, and we create a list of what patients want, and we create a list of what dentists and their teams want. And we see that there's certain items where consumers want something that's very different what dentists and their teams want. And the groups that are the dental teams that are creating the ability to give patients what they want, they're the ones that are screaming forward. Because when patients get what they want, they tell people. And now all of a sudden practice referrals goes up and it's a whole new ball game.
It is. It can really tremendously drive growth, as we've seen. The more focused you are on giving patients what they want, the more likely you are to grow in a big way. Right. Well, shall we move on to another mega trend?
Sure.
we are seeing a tremendous amount of increasing PPO prevalence in current markets. And I have to laugh because not an hour earlier, I got an email in my inbox whose heading was PPOs stink or something like that. And I had to laugh because
Or
we all,
something like that.
yeah, we share that sentiment in some ways, but for many of us, there's an increasing PPO prevalence. And I think we've got to see a shift of paradigms here. I think too often we're angry about this. Instead of looking at it as an opportunity, we resist or we're bitter about it. So let's talk that through a little bit, Dr. John, with what we see with increasing PPO prevalence. It's another significant trend. And if it's not in your market yet, it's coming soon. Wouldn't you agree?
I would, and it has surprised me. I've been in markets um, that have been PPO penetration, or the penetration of PPOs has been very high for some time. And so as we speak around the country, it always amazes me when we're someplace where we ask, does anybody have insurance that you can bill the patient for the difference between what the fee was and what the patient and what the insurance company charges. And it's so amazing to me to see how different it is. So if you're in California, forget it. You don't have any indemnity insurance. It's all PPO. But we just spoke last weekend at the Yankee meeting in Boston, and there was quite a bit of indemnity insurance left. So PPOs have not totally penetrated there, but the trend is very, very solid all across the country. There's more and more of this. And what's driving it is insurers are trying to control their healthcare costs, and they see that they can have PPO coverage for their employees at a lesser cost, and that's what they're purchasing for their employees. The employees don't want it, the dentists don't want it, but the employer is the one who's putting up the money for it, and that's what people get.
Yeah, I think, when we look back at what has changed and what is currently changing, we look back at the time when we could say we refuse to participate. We don't want to compromise on your care. This is an image. We will not allow insurance restrictions to determine your quality of care. And although that's a nice sentiment, for many patients, that's one of the things that they want. They want a dentist who's going to accept their insurance. So we have a challenge, and the challenge really is communicating the value to patients for services that aren't covered by their plan, but also being willing to become familiar with the plans that we're accepting and helping patients maximize the potential benefits from those plans. You want to talk for a minute about the Kodak study?
Sure. The Kodak study has been so widely talked about in dentistry, and basically the premise of this is that if you raise your fees a small percentage, your profitability will skyrocket, and if your fees are lowered, your profitability will just plummet. And frankly, we all know that that's not true. Now, if you think about the world, if you think about just numbers, you could, oh, here we go, yeah. So if there's a practice that has 25% profit, here's what the study determined. 3% price decrease drops profitability 13.6%. Now, I can tell you that this study was done with a spreadsheet, and they were just plugging in numbers. They weren't plugging in human behavior. So I think the next one shows what happens if you increase price. Wendy, yeah. So here's what happens here. Oh, 3% price increase means you can make the same profit on 90% sales volume. So if you increase your prices 3%, you can lose 10% of your patients and still make the same amount of money. Now, if this is true, come on, this is a joke. If this were true, wouldn't we pay, if the secret to profitability was just raising your fees in any business or in dentistry, wouldn't we'd be paying, $10 billion for a gallon of milk. If that's all it took was increases in price to have more profit, that's not how the world works. That's not how the consumer works. There is price sensitivity. And so the argument against PPOs were, oh, well, let's not take PPOs. We'll lose those patients. but because we can raise our fees, our profitability will be the same. And that may be true at the 1%, 2% level, but as you get farther away from that, that the entire premise of the Kodak study just absolutely falls apart.
So the people that we see that are really succeeding um, in practice, what's really interesting is how many insurance plans they accept. Wouldn't I mean, I have been just stunned by how many practices are doing really, really well and serving their patients at a high level too. You know, I think sometimes we falsely assume that if you accept PPOs, the experience has to go down. That's not true. You know, we have many practices who have incorporated systems that serve patients at a higher level, and they're still able to be profitable while accepting PPOs. You know, systems for efficiency become really important if you're accepting lower fees, but especially if you have the capacity to deal with the demand brought on by the PPOs. We've seen some practices doing tremendously well, even with this model.
The CEO of the largest dental practice in the United States, and by dollars, certainly the most profitable in the United States, told me that one of the things in the practices that they own, they have been able to track that tracks perfectly with profitability is the number of plans accepted by an office. The more plans, the more profitability. And I know that goes against conventional wisdom, and I didn't believe him when he told me that, but I have observed it so many times now that I believe that he's absolutely right.
So Dr. John and I aren't necessarily advocating go out and start accepting every plan under the sun. What we are saying is we are seeing a shift. And if you have efficient systems and capacity to deal with it, accepting PPO plans can be very profitable for you. And
PPO plans are coming to you. Now, what you do with that depends on your own practice situation. So this is not a one size fits all. And this is why we talk about this when we lecture a lot, because this requires thought, it requires strategy, and it requires the CEO mentality of how we deal with it.
Yeah, and like we said, if you are doing well and you're continuing to grow and you're not accepting PPOs, then for heaven's sake, don't change a thing. But for some practices that are looking to grow and they're having a struggle today being as effective as they once were, it's something to evaluate. So Dr. John has a formula that he can talk through with a lot of doctors on, you know, where they stand from profitability and help them determine which insurance companies may be a good fit based on goals and all of those things. So it's not something that you want to just jump into necessarily without some thought and some study, but the philosophy that if you accept PPOs, the quality goes down and your profitability goes down. We just haven't seen that to be true across the board.
No, that's right.
And I think one of the reasons that our model works well with all practices, if you're a fee-for-service practice, it works great for you. If you accept PPOs, it can still help you attain a high level of profitability with the PPOs, is because obviously our model is all about maximizing hygiene and helping patients choose more than they may have originally planned based on what services you have on your menu that would benefit them. So if you have a patient in the chair that's covered under a PPO plan, we still, one of the things that we help hygienists do is have a higher level conversation with patients about preventive services that they would benefit from. And many of these preventive services aren't covered by any insurance, regardless of whether it's a PPO or any policy really. So what's exciting to see is what happens at the end of the day to the profitability and hygiene when we are maximizing the potential benefit of some of these additional services. We become tremendously profitable regardless of insurance plan that the patient is on. So our philosophy, our structure of making sure that we're maximizing the potential impact within hygiene helps those who are accepting PPOs become incredibly profitable. And of course, those who aren't accepting PPOs, the same thing applies. So our structure in maximizing every potential opportunity that comes from hygiene fits any practice model, but it's incredibly helpful for those who are trying to gain some profitability with the insurance plans that they're dealing with.
No doubt.
All right, very good. The last, I believe we're getting close to the last of the megatrends for tonight's webinar, and that is the corporate roll-up. So this has been interesting to watch. You want to kind of talk about some of the reasons behind this shift that you
Sure.
see?
We're seeing practices, I hate the term corporate dentistry because probably most practices in the United States are organized as corporations. But if I'm thinking about a corporate dentistry, I'm talking about multiple doctors in a group, multiple locations, maybe many locations. And these types of practices are growing very dramatically. They're growing by um, in the dental industry, they're growing probably somewhere, according to the ADA, somewhere around 12.5% per year. These practices are becoming higher in number. So the the reasons for that are several. One is that students get out of dental school with a significantly higher debt burden in the past. So not only, so they are higher in debt. I speak at 3 dental schools, and when I was in dental school, if you looked at my class, there'd be about maybe 10% of the class would be women. And today, when I look out in the audiences that I speak to, I'm seeing it's about half and half. And so we know, and dentists, women make wonderful dentists, and we have many women dentist clients, and they're marvelous. They in some ways are more nurturing than male dentists as a whole, and they make wonderful dentists. But one of the things that we know about women dentists is that they work less, as an average, they work less hours per day, less days per week, less weeks per year, less years per career. And so half of the dentists that are coming out aren't going to be practicing full time um, during their entire career. Now, to start a practice, to be a solo practitioner in a practice and not work full time is financially difficult. There's so much fixed overhead in dentistry and so much capital requirements that having someone part time very difficult to reach a significant level of profitability. So a lot of these people are going into corporate dentistry. I ask dental students when I speak to them, I ask, how many of you are interested in owning your own practice someday? And when I was in school, almost every hand would have gone up. I mean, there was a few that maybe wanted a military career, and there may be a few that wanted to teach, but other than that, every hand would be up. Today, it's only about a third. So the desires of graduates are really different than they used to be. And then look at what bank requirements are as far as down payments on getting financing. It's very difficult for a new grad to get financing. And so this is one of the opportunities for them is to join a group that's already there that can get them started, that can pay them a salary or pay them a guarantee for a short period of time to help them get up and running. So there is so those are all the reasons why dentists are shifting into this model. And there are some advantages. And so the advantages from a consumer perspective is the larger groups get, the more sophisticated they get on giving patients what they want. So they have phones that are answered. Um, sometimes most typical practices that are a single practitioner, it always amazes Wendy and I when we call practices because at least a third of the time we don't get a live person calling during normal business hours. And so, big groups figure out how to answer the phones, answer them over a large number of hours. They have locations. They have locations that are put in really good, convenient places, very retail oriented. They have good signage. If there's multiple locations, there's an efficiency with marketing. They all have the same brand. And these big groups can negotiate with insurers to get better reimbursement. They can negotiate with laboratories and suppliers to get better costs. Um, and they tend to be very sophisticated um, with their training, and they are working hard to have a very great patient experience. I think people have the misconception that these groups don't have dentists and dental teams just like the non-corporate ones. They do. They have them just like that. And they're people that are working hard to help their patients with their dental needs and have a great patient experience.
So that's, one of the questions we often get is, okay, how am I supposed to compete with that? How can I compete with, the marketing efficiency of some of these larger organizations? And what can we learn from this model? Well, we've already shared a few things. The patient friendly focus and some of those things are I think what some who are competing very well are doing. This is one of the reasons that we've invited Kirk Huntsman to be a presenter at our summit coming up here in a few months, and we'll share that with you. But Kirk Huntsman has an incredible resume, incredible amount of experience and knowledge in dealing with the corporate model, and he actually lives in Texas and is helping dentists in that area achieve a higher level of effectiveness and utilizing some of the same systems and strategies that help create a high level of efficiency within the corporate model. So that's really what most dentists want to know is, what can we do to compete in spite of this emerging trend?
That's right. And Kirk's been on both sides of the fence, having run practices, one of the largest group practices in the United States, as well as running individual practices. And so he's got a very good point of view, looking at both sides of the coin, and how to really maximize the advantage that either side has.
And if we look at the picture here, obviously this is an old-time pharmacy, and if we look at what happened to their industry, um, it's really kind of a similar track that we are seeing in dentistry today. Now, do I think that the solo practitioner model will go away completely? No, I really don't. I don't see that happening. But again, like we said, there are some lessons that we can learn from studying what's working well in that corporate model. If, from efficiency to marketing to cost containment, I mean, there's a lot of really great lessons we can learn. So I'm excited to hear what Kirk has to bring for us
Yeah,
on
I am
this
too.
topic.
Yep.
Very good. Well, that brings us to our next um, slide, which, good heavens, that logo looks terrible. Let's just skip right past that one.
It's a little pixelated.
It is. There, that's better. So we wanted to extend a special invitation. We sure appreciate you taking the time out of your busy schedules to join us tonight. We hope you've learned something from our topic here. We have a series, as I mentioned earlier. Watch your inboxes. Your next invitation will be arriving before this week is over. Our next webinar topic is really exciting. It's all about revolutionary practices and the big idea phenomenon. So we're really excited about that. All of the topics that we've chosen have been thought out fairly carefully because they all point directly to topics that will be addressed at our 8th annual summit, April 25th and 26th in Dallas, Texas. Now, those of you, I've seen a few of you that are attending here that are our diamond level clients. You will be invited to attend a bonus day that's on April 24th. So we wanted to share a little bit more information with you about our summit and give you a sneak peek at some of the world-class speakers that we've invited. Dr. John and I host this, as we've said, for many years with the intention of giving our clients and our members, and of course inviting some who are not currently working with us, to learn what is working in dentistry now. So really, really powerful meeting.
Yeah, we're really excited about it. We have an awesome group of speakers that are going to be talking about that are really, because of their positions, they're able to see what's coming. And I think it's always better to be prepared and be at the tip of change rather than to be the one trying to catch up all the time. And this is really an opportunity for everybody to get onto the leading edge, and because there's already people out there innovating, and some of them are successful and some of them are not. And so those that aren't, I consider them on the bleeding edge. So we don't want to be there, but we want to be towards the front of things that are happening. And that's really what's going to be the focus of this, is how people can take advantage of the trends that are happening right now.
and building a better practice and a bigger future. I think that's one of the things that's important. The better your patient experience is, the better your level of efficiency, the better you are able to navigate these trends, the bigger future you will have, the bigger future you can build for yourselves and for your teams. And so we are just really excited about the lineup we have. The summit itself is always an amazing experience. We'll share a little bit more about the big idea on the next webinar. But I'm also excited to announce that this is the first time we've ever had a team event. We've invited a special performer to join us and do a team dinner on Friday night. And his name's Jason Hewlett. He's just an incredible entertainer. He's similar to Danny Gans, and he does celebrity impersonations, but he also has a very powerful message behind his performance. So that's a great opportunity to attend a team dinner, and the proceeds from that will benefit a charity. So we're really excited about the summit and hope that you can plan to join us. So that's one of the things that we wanted to share with you tonight is we are still in the early bird registration category. So regardless of your status, if you're currently a member, of course, we have excellent pricing for you. If you are a Diamond or Elite member, we have really excellent pricing for you. If you're not currently a member, we're still going to invite you to register and save a considerable amount of money with the registration if you register before the early bird deadline. So, Dr. John and I have been invited to speak at many, many events across the country, and we have worked really hard to provide an opportunity for our clients and for the dentists that we speak with that is cost effective, that you will see a very powerful return on this investment. So we would love to see you join us at our summit. So those of you that would like to have information about registration, there's two quick and easy ways to go about it. You can type in this email address or this web address, which is www.theteamtradinginstitute.com/summit2014, and then another slash, and that will take you right there. You can also call our office and request that we email you information about it, a registration form, or we could even fax it. We'll be happy to supply the information in the easiest possible way for you. So we are really excited about that. Now, if you have joined us tonight and you're not quite sure if the summit is a good fit for you, we would also invite you to call the number, have a conversation with Jeff. He's our consulting coordinator, and he can guide you or direct you to the best resource that we might have that can help you accomplish your goals here for the next few months.
Awesome. One thing I like about our summit is there's lots of great information, but there's a lot of fun as well. And so we hope to see you there. We think it's going to be an amazing meeting. We think we're going to have tremendous information to share. I'm going to be in the front row with my pad of paper taking notes because I am so excited about the information and the speakers that are coming. So we hope to see you there.
Very good. Thanks again, Dr. John, and be sure to mark your calendars. We've got another Megatrends webinar coming up next week, and on that we'll be discussing the big idea, which is a very powerful topic. So thank you again for joining us, and we are signing off for now.
Good night, all.